Hello, everyone, and thank you for joining the 12th webinar in our Pandemics and Society series. Today's event is H5N1, Gauging the Current Threat. Today, we will be discussing the recent news surrounding H5N1 and the potential impacts of its spread through dairy cow herds and farms, including recent reports of the virus in milk. We will also discuss strategies to prevent and respond to negative outcomes. I'll now pass it to our moderator today, Dr. Jennifer Nuzzo, Director of the Pandemic Center and a Professor of Epidemiology at the Brown University School of Public Health, to begin today's conversation.
Thank you so much. Hello all, and welcome to our discussion. Today we're going to talk about the current situation with H5N1, and we're going to attempt to gauge the threat and the road ahead. Though H5N1 is not a newly recognized virus, developments over the last year, and in particular the last few months and weeks, have greatly heightened concerns about the threat potential of this virus. We have been tracking H5N1, which is a highly pathogenic avian influenza virus, since the late 1990s. It's historically been a virus that affects birds, but humans that have had contact with infected animals have become sick. To date, nearly 900 human cases have been reported, and among these, almost half have died. And this statistic, while incredibly imprecise, does make H5N1 look to be much deadlier than COVID or even seasonal influenza. Over the last year or so, H5N1 has dramatically expanded its geographical range and the number of species it is infecting, and this has been quite concerning. And then we began hearing about mass infections and deaths in mammals, which has further increased our worries about the threat potential of this virus. But in recent weeks, reports of H5N1 in dairy cows in so far 9 states and 1 infected dairy farm worker have greatly increased our worries about this virus. This week, we also learned that genetic material from the virus was found in pasteurized milk, which raised worries not so much about the quality of milk or the safety of milk, but worries that it might indicate that this virus is spreading beyond what our surveillance in cows is telling us. And so with all of these developments happening today, there is certainly a lot to analyze and to discuss about what the road ahead should be. And so that's what we want to use this time to do. And so to help us think through these developments, we are fortunate to be joined by 3 top experts who have been tracking the H5N1. We are joined by Dr. Mary Margaret Phill, who's the Deputy State Epidemiologist for the Tennessee Department of Health. Dr. Phill has a lot of experience working on communicable disease surveillance and response efforts, and she's contributed to a wide range of events, including Tennessee's response to COVID-19. We're also joined by Dr. Gerald Parker, who's Associate Dean for Global One Health at the College of Veterinary Medicine and Biomedical Sciences at Texas A&M University. Dr. Parker has extensive experience in biosecurity and infectious disease and pandemic preparedness. And finally, we're also joined by Lawrence Sauer, who's Associate Director of Research at the UNMC Global Center for Health Security. That's the University of Nebraska Medical Center. She's also Director of the Special Pathogen Research Network. She has a robust background in disaster and public health emergency research and has been involved in numerous responses. So thanks to you 3 for joining us today. We would like to use this session to address any questions that participants may have. So I encourage folks to start typing their questions into the Q&A box. We intend to try to answer as many of those as we can, but I just wanted to start the conversation first with some high-level questions. Maybe if I can turn to you, Mary Margaret, in your role as Deputy State Epidemiologist, sort of what are you thinking about the current situation? What should we be doing to kind of further monitor the situation and prepare for new developments? Particularly, I would assume in states that are heavy with dairy farms are thinking about this, but what are your current thoughts about what we need to be thinking about today from the human health perspective in particular?
Sure. Good morning, and thanks for having me. I think as we've seen this progress over the last roughly month or so, I think a lot of us in public health and in the animal health space still feel that we have a lot of gaps in our surveillance. There has been a lot of work done. I want to acknowledge all of the existing, especially influenza surveillance systems that exist in the human health space. But I think both in the animal health and human health world, I at least personally don't feel that we have as much visibility on the spread of the virus in animal populations, nor potential illnesses in humans than we would really like to have. So, I think that's multifactorial. In the animal health world, I would love to see, and hopefully we will see with the new federal movement restrictions put in place and testing requirements that will go into effect on Monday, the 29th, that USDA announced just a few days ago. I think we'll have better visibility, at least in lactating dairy cows, how prevalent the virus may be, as they are required. Their milk is required to be tested before they move. But I think there are still a lot of questions in my mind around mammalian surveillance and other animals on farms, and certainly in other cattle species as well. I see a question in the chat already about beef cattle being tested, where it would really be helpful to have some more surveillance available in that space. On the human health side, I think we've also seen some news reports in the last few days, and I've certainly heard anecdotes from colleagues in affected states that it's been challenging for public health to engage with many dairy farms that are affected. And again, there's a lot of reasons for that. I don't want to point blame at the dairy farms or the farm workers. There's a lot of fear. There's a lot of misconceptions. There's a lot of concerns about potential negative lashback on them with pursuing that testing. But that being said, there are also a lot of anecdotes about farm workers with mild illness while they're working with cattle that are sick, or increases in sort of conjunctivitis or mild respiratory illness that may be seen in some of those areas that we really just don't have visibility on the testing that's happening or not happening in those populations to understand what might be going on.
Yeah, lots of conversation about the inadequacy of the testing right now. Maybe if I could turn to you, Jerry, sort of maybe picking up on that thread, or just the general question of what are you concerned about? You see this through the lens of both human health and animal health as a trained veterinarian. So what's on top of your mind right now?
Well, sure, and thank you for inviting me today to participate in this discussion. And I think thinking about this and the complexity of this is really a complex issue, and it's a playbook that we haven't played before. If we look at the other kind of human and animal issues with H5N1 in poultry, there is an established playbook, and there's the economics have been dealt with in that regard. But this is a totally new scenario with H5N1 in dairy cattle, and I agree with Mary Margaret, before we start pointing fingers too hard anyway, that we need to understand those complexities. And I'm starting to talk about this in a One Health context. It's certainly a One Health context, but it's also challenging our notion of One Health. And we never have really thought about the human animal environment, but the economic trade implications of this type of scenario. And all of our frustrations on the lack of situational awareness and what is the true disease burden and viral spread in this is really that there are too many disincentives out there that are inhibiting our ability to do the comprehensive epi investigation and active surveillance that all of us need to have, in both to protect the agricultural sector and also to protect public health. And so I think we really have got to deal with economic drivers, both for the commodity industries, but also we need to deal with some incentives to make sure that the workers on these dairy farms and in the supply chain feel comfortable to come forward to seek medical care. If it's potential infection, occupational exposure, but even just chronic health conditions that they may be experiencing in these dairy farm settings. So this is a very, very complex issue, but I really feel like the economic issues, we got to deal with them. We got to deal with them quickly, and we got to understand it for future scenarios. It's just different. We haven't dealt with it, and I think that's really the root cause of why we're all frustrated with our lack of situational awareness.
Yeah, I mean, that's interesting. In human public health, we may just lament that the economics are getting in the way of taking the actions, or maybe getting in the way of taking the actions that we think are need to be done, or we could just recognize them and try to work within the context that we have. Yeah, quite pragmatic. Lauren, what about you? You've been thinking about this virus for a long time, particularly from a special pathogens perspective, as well as also from sort of the human sort of medical response to future pandemic scenarios. What's like anything jumping out at you in the recent developments what are you most worried about right now?
Yeah, thanks, Jennifer. I mean, I think, there is a lot to be concerned about. There is a lot going on in this situation, as both Mary Margaret and Jerry have mentioned, in a general sense that we just don't know. We don't have the data that we need to really understand the entire complexity of the context. And from the human health side, and in particular, the preparing of the healthcare system side, a few things stand out to me as being concerning. The one case that we had and the anecdotal information about potential other cases that either didn't test positive or weren't tested look different than we expect to see in human influenza cases. And so anytime something looks different, in humans, we have a hard time identifying it early. And so there's a potential for this virus to get into humans for a good amount of time before we are really having a good sense of what that denominator is, or a good sense of what this looks like in people, which means those people could slip through the cracks and give this virus to other people, right? And anytime that happens, we get concerned. I think the other piece that is worrying to me, besides the surveillance data and the testing problem, so to speak, is that our healthcare system is dramatically underprepared for another pandemic. We have a workforce issue, we have a capacity issue, we have a current overuse of the hospital issue. And on top of that, we have a diminished trust in healthcare, in public health, and in vaccines and medical countermeasures. And so when you put all of those things together, you have the potential for people to delay seeking care or delay in use of tested and available medical countermeasures. And that means they're going to get sicker outside of the hospital system earlier. And seeing sicker patients enter into the hospital system that is dealing with workforce shortages, is dealing with bed capacity issues, and is dealing with myriad other problems, means you have the potential for loss of higher loss of life and higher morbidity and mortality. And all of these issues, I think, have the potential to create a situation where if we don't get ahead of this early, we're going to see a very dramatic impact.
So there's a lot of participation in this webinar, which I think is great that people are coming seeking information. And I can imagine for many folks, they first started paying attention to this storyline, if you want to call it, that after the reports of H5N1 genetic material found in milk. So I'm just going to throw out there, here's how I'm thinking about this issue for those who may be chiming in, and tell me if you think there's anything wrong with that. One is that just finding genetic material in milk doesn't by itself indicate that there's a problem with milk. Pasteurization can kill or inactivate pathogens, but doesn't necessarily remove virus or other pathogens from the milk, but that we fully expect that pasteurization works to do that. So far, I think the tests that would tell us whether there was a problem in terms of threats to humans from pasteurized milk have come back negative, meaning that they haven't been able to grow virus from the milk. I just wanted to check with the three of you that that's consistent with how you're thinking about it.
Yeah, I'll start, and I
Thank you.
agree. I have really no concerns about the safety of our milk supply, pasteurized milk. It is good that our colleagues in government are actually doing the confirmatory tests, specifically with H5N1. But I have high confidence that the milk supply is safe. I think what's concerning about the findings, though, is it's just another indication that the virus is much more widespread than we realize and than what's been reported.
And so maybe we can extend. Sorry, go ahead, Mary Margaret. Looked like you were going to also weigh in here too.
And I was just going to say, I agree with your synopsis, and I agree with Jerry that I certainly think the worry to me from that was not the finding of viral particles in the milk. It was more that it indicates both that probably more cattle are impacted, but also that there are likely more asymptomatic cattle that are impacted than we're capturing. And so, I think since the focus for surveillance testing in cattle so far has really been on symptomatic cattle, I think that just sort of heightened my concern that there is likely a lot more virus present in the milk of asymptomatic cattle than we have previously understood.
Yeah, and I think just to flag on both of those comments that the milk doesn't come out pasteurized, right? So there is a level of risk if we're seeing a lot of milk with virus in it. To Mary Margaret's point, that it's much more widely spread than we're thinking about. There is a processing step that has to happen to get that milk out of the cow and into the bottles prior to pasteurization, into the process of pasteurization, that puts people at risk. And so I think understanding
And when you
how
say people, you
widespread
mean
this
farm workers
farm
who are
workers,
involved with
yeah,
that.
absolutely, and other animals in the area potentially, and the cows themselves. And so understanding how widespread this is essential.
Yeah,
And
and I would say not just farm workers, but also the workers involved in the processing of raw milk and the pasteurization and bottling process and that whole industry as well. I think there's been a big focus on the people on the farm, as there should be. But I think given that we have seen the presence of, from my understanding, live virus in raw milk, that we also need to fully understand the occupational risk to people that work more broadly in the dairy industry, even once the milk leaves the farm.
Yeah, that's an important distinction. And I just wanted to say, because I didn't include this in introducing you, Mary Margaret, but for parents like me whose kids are milk obsessed, yeah, just want to point out that you are a pediatrician. And so just they might be, that might be a question they might be asking their pediatrician, which is it okay for my kids to drink milk? So just wanted to put that out there. My kids can still drink milk.
But, and I'll add just one more thing too, because, I'm sure some of the other domesticated animals on the farms and so forth will drink some of the raw milk as well. And that's probably how some of the cats may be getting infected or whatever. And we have reports of cats turning positive and dying. And so it's just another opportunity for spread to humans and other mammals.
Jennifer,
Yeah,
there's a question just before we move on from this topic about raw milk in the chat. And so, I think even though the bulk of the consumption of milk in the United States is pasteurized milk, it is important to flag that there's been over the past, half decade or so, a growing raw milk, let's say, level of enthusiasm. And we see people accessing and consuming raw milk. And so while it's a small portion of the total milk consumed, it is a potential real threat in this space.
Yeah, and I saw a statistic somewhere that nearly every state allows some form of raw milk sales, so it is not inaccessible in the way that it used to be. So that is an important point. I did want to, though, I'm not trying to move on from this, but given that I'm imagining why people are showing up in terms of what their concerns are, that to say that when we say there is heightened concern, what I'm hearing from you all is that our concerns right now largely center on the occupational exposure risk, the people who are working on these farms and also the processing steps. I'm sorry, I'm sort of conflating them all into farm workers, but thank you, Mary Margaret, for making the distinction that there are other workers who are can have exposure to raw milk that we do worry about. And that's where I think it sounds like our primary concerns are right now. Would you all agree with that?
Yes, so we're all kind of nodding.
Okay,
Yeah,
just want to say, and then because they can't see you when you're nodding, but and then the other concern that we have, of course, is just thinking, what do these infections mean for the potential evolution of this virus and the threat that we don't yet see, but want to very much avoid, which is that seeing an increasing circulation of this virus in mammals. It was previously thought of being a predominant bird virus. Seeing it in mammals makes us concerned about its abilities to, so far we know humans can get sick, but it hasn't happened that frequently that we know of. And would this signal an increasing ability to potentially infect humans? And then the worst case scenario is increasing abilities to not just infect humans, but be spread between humans, which would meet the definition of a pandemic in the sense of it's a completely new strain. And if it were capable of human to human, sustained human to human transmission, we should be worried that we're at the start of a pandemic. So I just want to make that clear because I think it's sometimes hard for people to parse when you hear experts being concerned that I think at this point, if you're just part of a member of the general public, the threat of this virus remains low, but we, as a preparedness field, are watching this to try to get ahead of it to prevent it from becoming a bigger threat.
Yeah, I completely agree with that, Jennifer. I think, though I will say we have a long-standing history of not doing things until the thing is already a problem, right? And so, I mean, I would call this a problem right now, especially given that we don't really understand the full landscape. But we have an opportunity, we have a runway to actually make changes to how we are doing surveillance, how we are scaling up vaccine availability, how we are placing and encouraging the use of Tamiflu in mild cases to stop what's happening in animals and hopefully create a situation where this is not, the risk does actually remain low to the general population. And if we don't take advantage of this time where we have visibility onto a growing problem, it will be a much larger problem, and that has the potential to do that very quickly.
So I'm seeing a ton of questions and I just want to turn to them, and I'm sort of scrolling through them and seeing if I can kind of lump them in. There's a lot of questions about surveillance and what kind of testing we're doing. One just very quick question, maybe Jerry, you can answer this, is how do cattle get tested for H5N1? Do they get nasal swabs like COVID?
The samples are collected. Actually, I think the testing is also complicated. And I think the USDA order now that's going to start on 29 April of test to move policy is what I call it, is going to be also logistically challenging because testing is not a pin side test. It's a collect a sample, send it to the state lab, send it to the national lab. There's several days of delay, to get the results. And what do you do in the interim? And can the cow get infected during that interim? I think there's some logistical challenges that are really going to have to be managed very, very closely in this testing thing, because it's still kind of reliant on the laboratories and the NALM network, the National Animal Health Laboratory Network, and connected to the USDA laboratories. So it's a complex, logistically challenging effort that's going to be undertaken. And I'm sure the labs are also worried about their ability to surge and be able to have the throughput to do this testing. This is one of those things we really need a point of need or point of pin test to do this. We don't have that right now.
And they're testing milk. Yes.
I don't know exactly how that is, but it's the same, they're collecting samples of the milk, sending it to the lab, and waiting several days to get the results.
So I'm just going to highlight there to fill in the blank there that form of testing, while it may be helpful for knowing whether you could move the cow and whether the cow would bring virus with it, although there might be a delay there. And we know from COVID that negative testing one day does not ensure that the virus is not there. But it's not a sufficient way to test to protect workers who may have been exposed. It's not sufficient for the spread, mitigating the spread within states. Anything else? Any other concerns about our current testing? Let's just kind of walk through the current testing approach and where your greatest concerns are. Anybody want to chime in on that? Mary Margaret, I know you brought up the asymptomatic piece. Yeah.
Oh.
Sorry.
I was just going to say, I think we're still looking under streetlights, right? We're not looking where we don't already see indicators that the virus is there, and that never gives us enough information. So I think, there's been a lot of focus on only testing dairy cattle, but dairy cows and beef cows are still cows, and so looking in places where we're not currently looking is probably really important. And I think doing some looking into nearby swine farms and and maybe even asymptomatic poultry farms right now that are in the same general vicinity is really important to understand. Are we dealing with a lot of asymptomatic cases to get a better sense of the denominator? You know, if we're still seeing all of our tests that we're giving coming back positive, we're not looking far enough.
Mhm.
Yeah, I mean, the testing has been extremely limited to date, and it is good that we're moving into a test to move type policy, but it's still not going to be adequate to give us a better picture of situational awareness on the extent of the viral spread already, and maybe when it will also get under control, hopefully. I think we also need to understand, totally agree that, you know, any swine farms that are nearby, that needs to be concurrent, but we already have at least 8 poultry flocks that are relatively near some of these affected dairy herds. And how's the virus transmitting from cow back into birds? How is the virus transmitting, cow to cow? Some of, our epi investigations just need to be really aggressive to understand some of these very basic questions, in addition just to the testing and active surveillance.
Yeah. So aside from the test to move policy, the testing is still voluntary and still restricted to symptomatic cows. And Mary-Mar, you had brought up the asymptomatic issue. There's at least in one state testing of asymptomatic cows identified infection, and certainly the discovery in milk raises the prospect that either there are symptomatic cows not being tested, or I think probably even more likely that there's asymptomatic infections that are not being diagnosed. Yeah. There's questions here too about testing other animals, and I think that is one. There was a question about beef. Beef is not, there is not a recommendation for testing beef cattle. Jerry, does that make sense to you? Is there a distinction that we should be thinking about in terms of dairy cows
Absolutely.
versus
We need to be,
beef?
yeah, we need to be testing the beef cattle as well. It's quite interesting, though. It seems like in the dairy cattle, the viral loads seem to be concentrated in mammary gland and milk and so forth. And but there's nothing unique about a dairy cattle and a beef cattle that I'm aware of that would mitigate infection in beef cattle. So we need to understand much more than just testing in dairy. And that's harder. At least there's human touching of dairy cattle every day. Beef cattle is a little more challenging. But nonetheless, we need to do some surveillance and to find out if it is in some of these other species. I mean, we know it's in farm cats. We know it spills back into poultry. Where else is it spilling into?
Yeah, there was an article that I read yesterday where some vets were concerned about, needing to be a little bit more proactive in testing of other agricultural animals, and for the purposes of protecting them. And then also I would extend that to protecting the people that have contact with those animals. Obviously, when you find this virus in mammals, that increases our worries. But when those mammals are ones that humans have very close contact with, that further increases our worries about the potential for the further potential for this virus to evolve. Jerry, one more question for you that's come up is about how similar are cows to humans in terms of, when we talk about birds versus humans in terms of the ability of viruses that affect birds to infect, at least influenza viruses to infect humans, we talk about differences in the lungs of birds and humans. But what about cows and humans?
I think in regard to this virus, I think there's a lot we don't know. I think we know a lot more about swine and some of the receptors that swine have that may be more similar to human receptors. I don't think we know enough about the cattle. At least I'm not aware about those words. But what we are, I mean, it's obvious though now that in fact, there is a report of a mutation that's been observed in cow that seems to indicate that the virus is becoming more fit for cow-to-cow transmission. So that's a concern. But one thing I did want to raise is that most of us on this call today have been tracking this virus H5N1 for over 20 years. And we're all keenly aware of its pandemic potential if it ever were to pick up the characteristics of human and then human-to-human transmission. I think many in the public and many even in the the agricultural sectors haven't been following that and may not have that appreciation of the seriousness how H5N1, why it's been such a concern for those maybe few of us been tracking, relatively few of us that have been tracking this for over 20 years as a pandemic potential pathogen. So I think we're also going to have more conversations to educate a broader community about why we find this virus concerning.
One thing that strikes me as quite stunning is the difference in approach to managing this virus on poultry farms. There was questions about lessons learned from controlling the virus at poultry farms versus in cattle. My understanding is that the requirement is that if you identify a single infected bird in a poultry farm, there's the flock is culled. Obviously, this virus is deadly to birds, so there is a deep incentive, a very obvious reason to do that. But the response in cows, finding this virus in cows, has been, up until recently, voluntary and not really aimed around trying to prevent the spread to other cows. I mean, I guess are there lessons there? Are there concerns there? Just any reactions that folks have to that?
Yeah, I mean, I'll start, and I think, and I kind of put this in the category of we have a playbook, and in the poultry, it is highly lethal in poultry, and there is an established playbook and regulatory framework and indemnification and the economics have been dealt with in the poultry industry, and there are incentives to cull and repopulate and restart because the virus is so highly lethal. Again, I think we need to remember this is the first time we've detected it. We don't know if it's the first time, but it's the first time we have detected H5N1 in dairy cattle, in the dairy cattle industry, and where there is no playbook. Why didn't we think about this scenario before this happened? That's a good question, and I don't know the answer to that, but this scenario should have been thought through how would a response unfold, especially when the virus is not lethal in dairy cattle, at least not that we know of. I haven't heard reports that there are deaths in dairy cattle that are directly attributed to the virus. I believe I've heard that there are deaths, but they're secondary to H5N1 infection. So it's different. It's a different presentation, and different economics, and so we need a playbook for this, and we need to think through the economics and what if a cow does have to be pulled off for indefinitely, then we need, what are the incentives so the industry they want to do the right thing. They want to protect public health, but they're dealing with their livelihood. And we in public health need to understand that. And I think working with USDA need to better understand that, and with Congress, what are some of the new policies that we can have to deal with this scenario?
I'm wondering if there are any lessons in terms of occupational risk mitigation from poultry farms versus cattle farms, or are we just bad at it generally? Do you know of any?
I think the occupational exposure risks, there are clear. I think there are clear guidelines and how you need to protect the workforce there. I think that's probably a work in progress right now. How best to protect from occupational infections in the dairy industry, in the dairy farms, and we have a unique kind of workforce too that we have to consider in our dairy industries to make it more challenging.
Some questions here about transmission of this virus that I'd love anyone who wants to chime in. One, is there any sense of how the virus is being transmitted? I'm assuming they mean between animals and maybe from the animal to the human. And is there a chance it's airborne? Anybody want to take that on?
Yeah, I'm happy to start. I think from what I understand, most of the available evidence that we have really points to milk being the primary source of transmission. Now, whether that's direct contact with milk, where people are then touching their mouth or eyes, aerosolization of milk through various processes, There's talk of the, cats and consumption of milk potentially, or, splatter. So, it seems from most of the investigations that have been done that the raw milk itself really seems to be the fluid that's most infected. Now, that being said, I think there's still a lot of thirst for additional data and knowledge around, environmental testing of, the surrounding environment and farms. There were some comments in the chat about, if cattle are shedding the virus in stool, and sort of, the environmental contamination that could happen that way. I understand from USDA that there has been some limited testing that doesn't show a lot of virus through that route, but they made the point very clearly that the numbers have been very small that have been tested, and so really there's a need for more information. And then I think we learned a lot about some of the environmental testing that can be done during COVID to detect the presence of virus in the air and in different industrial settings. And so I think doing some of those more in-depth studies would certainly be beneficial to really stratify the risk for workers and people that are working in these various spaces. I will sort of go back to the prior discussion around personal protective equipment for staff. CDC has released updated guidance for workers and use of PPE to protect themselves against novel influenza A viruses like H5N1, which is great and incredibly helpful with some nice infographics, but I'm not sure of the level of implementation of that on the farms across the country and how available those are. When you're talking about having to have a fit tested N95 respirator, we saw long-term care facilities during COVID that didn't have access to a respiratory protection program. I'm certain that there are dairy farms that don't have that type of procedure in place. And so, I think I would really like to see better understanding of, we have our sort of gold standard guidance, but then what's the sort of operational gap in actually making that able to be implemented in a realistic way on farms across the country and processing plants across the country to protect workers.
Yeah, I would just add to that, that I think on either side, we are concerned about the involvement of birds, both poultry and migratory birds. And so, there is, I believe, in one of the early USDA reports, evidence that some of this came from the litter that is placed in the farms coming from poultry. And I think we sort of underestimate how much that is involved in large scale farming industry operations. And then I also would just flag, that some of the sequencing data that has recently been released indicates that there may be some spill back into birds. I think we talked about that early. And we have migratory birds returning very soon to this area of North America. And so being prepared and doing some transmission studies quickly and efficiently to better understand what that interspecies virus movement looks like is really important. We don't have a lot of time to understand that before the migratory birds return.
Yeah, I think this conversation just really identifies that there are just so many unknowns. There's a lot of theories about transmission, all of them kind of reasonable theories, but this just, we need some aggressive research done like now to begin to try to dissect these theories. And there's probably multiple theories, but we need data to understand it and so forth.
And I'm just kind of scrolling through the questions, seeing if I can bin them. There's a lot of questions about like, well, how is this transmitting? And I think the answer is we don't know. Yeah. And there's questions about like chickens being fed to cows, and there's questions about waste. And I think these are all reasonable things to be concerned about, but the truth of the matter is we don't know. And some of this is because we haven't systematically tried to collect answers to these questions. Some of it is that it's actually quite hard to get the data to answer these questions. And Mary Margaret, you sort of talked about the challenges in doing surveillance on farms, particularly among farm workers. And Jerry, you mentioned that how the economics might be sort of at odds of that. So there are some real challenges here. There is a comment here, though, about, expressing somewhat some worry that, we don't know may be a bit of a excuse, or not an excuse, but being used to perhaps slow action, meaning we don't know fully the answers to these questions, but shouldn't we be acting in the interim? And I see the the participants can't see you nodding, but I see you all nodding sort of furiously to that yes, which is yes, take action. That action includes making sure that we go out there and try to collect answers to these questions, but not waiting for there to be answers to these questions. There's some other questions about sort of safety of beef. Again, anybody have concerns about that at this point?
I mean, I don't have concerns about it. I mean, I think we need to take proper precautions, but it's another thing we need to start doing some active surveillance in beef cattle and testing just to see, so we can have some basis. But we have no basis to think that beef is unsafe at the moment. But we again, we just need to collect data to see if our risk assessment would be altered.
And maybe I'll just add to that, just moderator chiming in here, which is just that there are other pathogens that we worry about from, and although we are concerned about H5N1, it is, first of all, not typically known to be a foodborne virus. I never say never, but not typically known. And we don't have any particular reason to think this virus would be hardier in terms of processing like pasteurization than other pathogens. Is that safe to say? Anybody disagree with that?
I agree with you.
Okay, great. Excellent. Just scrolling down here. There are a lot of questions actually about like the global piece to this, and that's actually kind of an interesting area that, so far this isn't a US story. But just wondering if anybody has thoughts on kind of the global dimensions of this.
Well, it's an interesting question. I mean, I think we need to keep it the top of mind as well. I mean, as an example, I did an interview yesterday for New Zealand TV channel, and they are what got their attention was the detection, PCR detection in milk, and now that's has, I think, some people in New Zealand concerned. So I get, this is not, even though right now it's a US problem, I think the global community is paying attention.
Yeah.
And I was in Singapore too a week ago, and the conversation about this issue was happening in Singapore. So it's not, the discussion and concerns are not limited to the United States.
Yeah. I want to maybe turn now to thinking about sort of the road ahead and like what actions we should be recommending for public health officials, and sort of what do we want to see happen now? Obviously, we're talking about primarily concerns right now are protecting the workers who may be exposed to this virus, but we also are concerned about the further evolution of this virus and what it might mean and what actions we should be taking to prevent that. So I'd love to hear each of your thoughts on that. And then I also want to talk about, if the extent we can, sort of vaccines and other tools that we may have, because we hear, some sort of, well, we've been tracking this virus for a while, we're not starting from scratch, et cetera. So anyway, whoever would like to chime in first on that. Maybe I'll put you on the spot, Mary Margaret, being our public health representative here.
Yeah, I mean, I think I would go back to my comments from earlier around just, I think in my mind, the immediate next steps and greatest needs are really just filling in some of those surveillance gaps. I don't expect we're ever going to detect every case of this among animals, but I think really expanding, especially mammalian surveillance, both in, wild animals with mortality events, which right now is really a very sort of convenient sample, depending on what state you're in and how aggressive various, veterinarians may be in pursuing testing. But as we've talked about, really expanding that ring of surveillance in the livestock population. I imagine there are many farms across the country where we have many different livestock species, especially smaller farms where they're interacting with each other and they have communal spaces. And so, being thoughtful about ensuring that we're detecting this virus if it's present, not just in dairy cattle and beef cattle and barn cats, but also sheep and goats and swine and, those other mammalian species we want eyes on. And then, I think I think public health is doing a lot of work in trying to build bridges and relationships with the dairy industry. That's often happening very much at the state by state, community by community level. But I think, continuing to lean into those conversations and also to seek creative solutions. I was at a meeting with a lot of my colleagues in the southeastern states within the last couple of weeks, and we talked a lot about how sometimes like public health does things because it's the way we've always done it, but it doesn't necessarily mean that it's the way we have to do things. And so really trying to bring all those partners to the table to think about creative ways to get access to farms, to engage farm workers and occupational dairy industry workers in testing and surveillance in a way that is more comfortable for them than perhaps our traditional way. And then I think the last comment that I would make is just in the surveillance realm, the anecdotes that we've heard about cases of mild illness among farm workers in many ways is reassuring, right? Like if there are human cases and they're that mild, that's great. We know the data that we have from Southeast Asia is not complete. There is undoubtedly an underestimation of cases. We do not have a good denominator there. And so that, 50% case fatality rate is not accurate. It's what we know based on the information we have. But that being said, I think a lot of our flu surveillance right now is very much focused on hospitalization. So we look a lot at emergency department data. FluSurvNet looks at hospitalizations from influenza. And I worry a bit that if we wait until we see a spike in those systems, that perhaps we would already be seeing much more widespread community transmission or occupational transmission than we really want. So I would really love to see some proactive conversations in the public health and healthcare space about increasing surveillance from outpatient samples and from urgent cares, where I think we would probably detect that more mild illness sooner if we do start to see this leave, the farm worker population and be more widespread in communities.
Anybody have anything to add there?
Yeah, I agree with everything that Mary Margaret just said, as usual. And I think that, a couple of things that I would add to that is recognizing that a lot of the US that is going to have impacted large herds also has a culture of keeping backyard herds, small independent farms, livestock shows, 4-H shows and things like that. And so really spending a lot of time to get back with the community and start to talk, communities affected, and start to talk about what the risk looks like to them or potentially looks like to them, and things that they can do to protect themselves, especially if they're not associated with large scale factory farming. So, kids at livestock shows, immune compromised people at livestock shows, things like that. And re-socializing vaccination and re-socializing PPE. I mean, we really have a longer way to go than we did in the beginning of the COVID-19 pandemic, even for very specific populations or smaller populations. I think starting the conversation right now about what we know, what we don't know, and what our plan is essential, because we don't have the opportunity to start at the same threshold that we did in the beginning of the COVID-19 pandemic. And so if we can take advantage of the space to have a conversation about how the vaccines are being built, how they might potentially be distributed, who's going to be the priority populations, why PPE might be valuable in this situation, just as if we're doing it for the first time, we will have an opportunity to bring some of that trust back into these interventions, and we can't risk starting late on that.
Go ahead, Garrett.
Yeah, I was just gonna say, I want to echo both comments from Lauren and Mary Margaret. And I think really what's critical in the short term is building new bridges, building new partnerships between public health, the animal health community, and then the dairy commodity group, and not just the dairy farms, but the downstream processing. We have to build new partnerships and have those conversations and understand what everybody is. Then I also think we need to be thinking about, not only I call it the vaccinations that Lauren was getting at, but also how do we, what are our triggers if we all of a sudden begin to see that there is more human infections and there's some indications of human to human transmission, what are going to be our triggers to actually pivot and go from what right now is a wait and see policy and approach to an all hands on deck approach? And we do need to probably think through those triggers and be communicating and educating the public right now about some of the things that are going to be needed so that we can actually get vaccinations and antivirals to where they need to be and actually used if we can scale up.
I will just say, I wanted to cue up the vaccination conversation. I feel that the communication about what kinds of vaccines we have, how much, how well they work, how we would use them, whether we should be using them for farm workers right now, which I feel strongly is something that we should be talking about more.
Yep.
I don't feel great about that. I will just say, I don't feel like there has been enough transparency. I wanted to put that out there. And if anyone wanted to add, if they feel like they can add to that, I just don't feel like, given what you all just said about the need for communication and just trying to think through the next steps and socializing, and that we are starting in many ways, perhaps at a bit of a disadvantage than we were at COVID, just given level of tolerance and trust, et cetera, that we need to be a lot more transparent and communicative about the vaccines and our plans for vaccines. Any disagreement with me?
No disagreement,
Okay, thank you.
but we've got to find a way to have that, to be effective at our communication. And that's where we've been challenged in the past. So we've got to, find that way so that we can be effective and become a trusted voice. And I think right now we're probably, even with with our early response just in the dairy cattle H5N1 issue, even for myself, it looks like more transparency is needed just to what is the plan?
Yeah.
And we haven't really seen what is the plan other than wait and see.
There's a particularly provocative question here. It says, how would this discussion and sense of urgency today differ if, say, last week we had reports of 3 additional human cases with 1 case hospitalized? Lauren,
I think,
Maybe coming
from
to
my
you.
perspective, I think that a hospitalized case in particular would ramp up the sense of urgency, at least on the human public health side, and human healthcare side. I agree with you on your concerns of the vaccines, and I think a hospitalized human case would really create a need for a much more vocal call to action on both where we are on therapeutics and vaccine. And if that was 1 out of 4 people hospitalized with what we a little closer to what we expect with H5N1. I mean, to Mary Margaret's point, we really don't have a sense of the denominator in any capacity over the course of the time we've been seeing H5N1. But I think a hospitalized case, especially if these cases are not linked within a single cluster, especially if they are linked within a single cluster. So if there's possible for human to human transmission creating those cases, I think that certainly from my perspective changes the urgency for ramping up readiness activities for the US healthcare system.
and I would say we shouldn't wait. I mean, we shouldn't wait for that to happen in order to, yes, obviously that would really heat up concerns greatly. But I don't think we should wait. I mean, we very rarely get to see smoke before the fire really burns. And I think what we're seeing now is starting to constitute some smoke. I mean, this virus may never gain the abilities to do that.
Mhm.
But why should we wait for it to be obvious that it has? Yeah. Question about wastewater. And actually, before I turn to wastewater, sorry, I just wanted to say point I just want to make to your point, Lauren. Yes, I do think that the possibility that there may be more mild infections out there than we're seeing is somewhat reassuring. We also recognize that farm workers are generally young. And as we've seen in COVID, and we certainly see with influenzas in general, that, not everybody may have the same risk of severe illness. And so that doesn't mean that that's how it would play out were more people to become infected. But question about wastewater. Does wastewater play a role? Should it play a role? Is it playing a role? Any thoughts about that?
Yeah, I'm happy to start. I mean, I think wastewater offers potentially a lot of opportunity to have, and it just again an additional mechanism for disease surveillance. I think you know, influenza testing in wastewater is still newer, right? And I think we still have a lot to understand about how we're detecting influenza in wastewater, you know, what those various concentrations mean, really how to interpret the results. And I think there are also a lot of questions about, you know, what is really reflected in the wastewater sample. So, you know, it's my understanding that most, you know, farms and, you know, dairy farms, like their waste should not be running into the sort of general population wastewater system, that they often have separate systems for handling, you know, farm waste. And so I think really having a clear understanding of what population is reflected by the wastewater sample is also will be important. So in my mind, I think it's a nice opportunity, but I don't think it's a slam dunk to really look at those results right now and know exactly what they mean without learning a little bit more.
We only have 5 minutes left, but there have been a bunch of questions about county fairs, county fair season coming up. Just does anybody have thoughts? Is thinking about what to do about that? I'm sure it's an issue in Tennessee, also Texas too.
Yeah, I have a lot of
Rhode Island, I'm sure. I don't know.
Yeah, I mean, I think this is one of those things that I don't want to wait until we see a problem associated with an agricultural event or county fair. You know, there's actually there's a really nice compendium on measures to protect the public from disease associated with animals in public settings from the National Association of State Public Health Vets. I think it's been a minute since it's been updated, but the core guidance is really helpful. And we've actually investigated recent non-influenza outbreaks in those types of settings in recent years in Tennessee and found that there's really just not a lot of awareness about this guidance in the agricultural community. And so, you know, I think we need to be really thoughtful about what animals, especially cattle, are present in those settings heading into the summer months at state fairs and animal exhibitions and 4-H gatherings, and think about, especially if we're worried about asymptomatic presence of this virus in milk in those animals. It makes me a little uneasy to think about, you know, milking competitions of elementary aged kids with seemingly healthy dairy cattle that maybe haven't been tested. And so, you know, I think that's an area where it would be nice to have some discussion soon in advance of those events taking place to be sure that they can continue, right? We want to encourage those engagements with the agricultural community that are often like part of the lifeblood of many communities across the country, but make sure we're doing it in a safe way that doesn't put people at risk.
And I think, Jerry, to just echo again your earlier points about the challenges of testing. I mean, I'm sorry, I feel like the number of times I've said the challenges of testing over the last 4 years, it's startling, but thinking about the various use cases for testing, not just, you know, can we move this cow across state lines, but also, is it safe to bring to the county fair and have kids milk and things like that. So those are other kind of infrastructure issues that we should be thinking about.
Yeah, of course. I mean, really all these different kind of applications, whether it's county fairs or, you know, something, we just need to have a much better understanding of our risk assessment and how we can, you know, mitigate risk. And we need the data to be able to do that. And I think at the moment we all feel challenged because we don't have sufficient data to really make informed risk assessments. We hope the risk is low. And I do believe at the moment it is low for the general public. It's a little bit higher for those in those occupational settings, but we really need more data to inform our risk assessment. Then our risk assessment will evolve. Whatever it is today, it may change tomorrow, and then we need to be prepared for an evolving risk assessment as well.
Okay, we have 1 minute, maybe in like a few seconds or less. Anybody have any, you know, burning point that you want to make that we haven't covered?
I think just continuing the call for transparency and increased data collection analysis. I think you know, we want to ensure that everyone has the information they need to act. And that is different information for different groups of people and different experts and different responders. And so this is a multidisciplinary problem, and it'll have multidisciplinary solutions.
Yeah.
And I'll just flag, because we had a lot of conversation about this. We have this worry of potential scenario that we are trying to get ahead of. And we just, I think collectively have established, we just don't think we're doing enough to prevent that pandemic risk. But even short of that, there are now urgent needs around worker protection, occupational issues that we think that we need greater action on. Safe to say?
Agree. And then I would add one other thing that's going to be critical as we develop new partnerships and understand where everybody stands and their perspectives, is we really need to think about the economic impacts and how the economic impacts can be mitigated in the commodity groups.
Well, thank you all. I really appreciate your time. Really, it was a great discussion, great engagement. Thanks to everyone who chimed in to listen. I'm sorry, we tried to get through as many of the many questions as possible, but we have them curated here, and we'll see if there's a way that we can try to answer some of them going forward. In addition to thanking my excellent panelists for the discussion and the participants, I'd also like to thank my team at the Pandemic Center who helped put this event together: Bentley Holt, Leah Lovegren, Amanda Kogan, Carly Gaska, Andrea Ulig, and Akmail Person. If anyone who's listening would like to share this event with someone who was unable to attend, just to let you know, the recording will be posted on the events page of our website next week. And you can also find recordings of previous webinars that we've held there as well. Please follow us on our social media accounts to learn about all of our events and future webinars. And you can reach out to the email address on the screen with any questions or suggestions for future webinars in our Pandemics in Society series. And with that, we will end. Until the next time, be safe, be healthy, and stay engaged. Thanks so much.